In tonight's Health Watch, some important news about a way for many Americans to reduce their risk for heart attack and stroke.
It is something that some are calling super fish oil, but it's not really fish oil after all. Dr. Max Gomez here to explain exactly what this is all about. Doctor.
Right. You know, it's derived from fish oil, but it's actually quite different. Fish oil primarily contains two types of omega-3 fatty acids, DHA and EPA. Vascepa, as this drug is called, is pure EPA. Now, an FDA committee has said Vascepa can be given to a much larger population of patients.
Arthur Vital is in some ways a very lucky heart patient. He's never had a heart attack, even though he's diabetic, a big heart disease risk factor, and his triglyceride levels are more than 4 times normal. He knows
that I have an extremely high risk factor for heart attack.
To try to lower his triglycerides, Arthur had been taking the same over-the-counter remedy millions of Americans take.
I had been taking fish oil, regular, shall we say, commercial grade fish oil for a number of years.
Which didn't seem to do anything for your triglycerides.
Which didn't seem to do anything, correct, which didn't seem to do anything for my triglycerides.
So now Dr. Robert Fishberg put Arthur on Vascepa, a highly purified form of EPA omega-3 fatty acid.
This is not your coronavirus. This is not your mother's fish oil.
In fact, a major multi-center, multi-year trial treating 8,000 high triglyceride patients with Vascepa showed remarkable results.
70% of the patients had underlying heart disease. 30% had risk factors. More than half of them had diabetes. And in this trial, they'll show a 25% relative risk reduction in cardiac events.
As a result, an FDA advisory committee has voted unanimously to expand which patients can be prescribed Vascepa.
So I think that patients with triglycerides 135 and over should be on this agent.
Now, even better, Vascepa seems to have a remarkably good safety profile, meaning it has few side effects. It is a prescription drug that will likely be given to many more patients for the prevention of cardiovascular disease if the FDA goes along with the recommendation of its advisory committee, and it usually does. That ruling is expected before the end of the year. So we'll see. We'll keep you posted.
Sounds promising, Doctor. Thank you.
Thanks, Dr. Mack.